Well, hello, plant-based buddies, and welcome to another edition of me winging it on camera. Today, we're going to talk about supplements, placebo, health hacks, lifestyle medicine pillars, and whatever whatever tangent I decide to go on. The reason I wanted to make a video is this: I just received a message inquiring about any supplements that could be used to boost energy and general health. Now, the issue with social media is that a lot of the content leads to believe that there is some magical extract that will make you feel better, faster, without any work and without investing any time in the process of changing your habits. Don't want to be a party pooper, but turns out that if you want to get healthy, you actually have to change your habits and have healthier habits and sustain them over time, right? So if we're talking about the lifestyle medicine pillars of health, these are evidence-based and scientifically proven ways of improving your health and your energy over the long term. Now, the unsexy part of it is that they're 100% evidence-based and proven to work, but they require time and effort and patience and skill and trial and error to try to fit it in your life, right? So there isn't any magical adaptogen or extract or supplement that you can take to reverse conditions and make you feel magically better overnight. Unfortunately, detoxes and cleanses, they're BS, okay? But if you want to follow the science and get healthier, well, consider a plant-predominant nutrition, consider increasing your exercise, consider getting adequate sleep, adequate social connection, consider stress management, whether it's meditation or art or playing music or listening to music or reading, and consider avoiding substances that are known carcinogens, like alcohol, drugs, smoking, red and processed meats. Now, I know this seems like a lot of work and it's not a magical supplement that creates little friction in your life and you can just swallow this pill and get magically better. I think that most people would love to do this. Now, there's a saying that we call stepping over dollars to pick up pennies, okay? So if the foundation of your health and your sleep, exercise, nutrition, stress management, having passion projects, social connection, if that's not on track, there are probably little to no magical extracts or supplements or adaptogens that will help you get your health back, okay? So you need to start with that. Now, let's just pretend for a minute that you decide to take a magical extract that you found on Amazon that had a great reviews and that you feel better. Well, kind of keep in mind that 20 to 30% of people that start or that take a supplement will feel better purely because of what we call the placebo effect. Now, the placebo effect just goes to show how powerful our minds are. A lot of people, if they start taking multivitamins or any extract or supplement known or boasted to create health, will generally start feeling better. Well, that's probably because you have a feeling of empowerment and you're taking charge of your health when you're starting these products or these supplements. Let's say we would compare them against a placebo pill, which is usually typically a sugar pill that's made to look and taste like the actual compound that we're testing. We see no difference between them, and that's where the scientific method comes into play. Now, if I give you this magical supplement and disguise it as a placebo, it's not actually the supplement inside, but you think it is, there are still 20 to 30% of people that will feel better taking it. And it goes to show that your mind is a powerful tool. If you really believe in something, very often it'll make you feel better if you do it. And that's the process of empowerment, right? I can give you, if I tell my patient to take a multivitamin, it'll make them feel better and they really have high confidence in me. Likely if they start taking that supplement, that they will feel better 20 to 30% of the time. And it's probably not the supplement that's causing that general well-being. It's the act of taking charge of your health, right? So that's where when someone recommends you something or sells you a supplement or sells you an extract, or sells you an adaptogen or sells you alternative therapies and they're working for you, great, that's awesome. Regardless if it's a placebo effect or not, if it's working and it's not harmful, I will absolutely 100% support it. But that usually leads to exaggerated claims where people are going to try to sell you that, but make claims about it magically improving your cancer risk or your cardiovascular risk or making you live longer, preventing aging, making your skin glow. And that's where it's very difficult for the consumer to differentiate BS in science. Now, that's the scientific method doing its work. If I tell you that there's no science on something, but it's working for you, maybe it is working and there's just not enough science on it, but maybe it's not working and it's the placebo effect. If it's not harmful and it's not costing you an arm and a leg, great, you can keep on doing it, that's all good. But I do have some of my patients that are taking about 8 supplements and 3 adaptogens and a probiotic liquid or juice that they're drinking every day, and then bragging to their friends how great they feel since they've been doing this and paying $200 a month on magical supplements. Now, 99.9% of these supplements have, 1, not been studied, 2, not been studied against placebo in a randomized controlled trial, and 3, it better work if it's costing $300 per month. And I'll give you the example for people that say, I got the laser in my ear and stopped smoking immediately. Well, if you're paying $500 or more for sessions of laser in your ear to try to stop smoking, you're already quite motivated and invested, and nothing works better than things that you pay $500 for. But when we test it against a placebo laser, we see that there's not more people that stop smoking in the placebo group than the actual laser group. And that's where it gets muddy, okay? When people start seeing benefits of something that has not been tested against placebo, claims can get made pretty easily and get exaggerated. And also, we need to talk about dosage when we're talking about extracts. So if I tell you that ashwagandha at a certain dose has been proven to diminish stress and anxiety by 5-10%, well, then a lot of people start putting ashwagandha in their magical probiotic drinks, stating that it will reduce stress, when the dose that's in the drink is infinitely smaller than the ones that were proven to be effective. So as I come back to my saying that, or the slogan that says stepping over dollars to pick up pennies, I mean, if adequate sleep, adequate nutrition, adequate exercise, stress management, and social connection weighs 50 pounds, most of these extracts weigh a few grams in the balance of health. So if you already have a great foundation and you want to add supplements that improve cognitive health and health in general, like creatine or blood flow like citrulline or beta-alanine or adaptogens like ashwagandha, for example, that's great, but you have to keep in mind that on a scale of 100 points, sleep sleep hygiene, nutrition, stress management, exercise, and social connection probably weigh 15 to 20 points each. And the supplements and extracts and alternative therapies, they may be weigh 1 to 2 to 3 to 5 points each when done perfectly and proven by science. A lot of them are not proven by science. Now, even if there's no evidence that they work, that doesn't mean that they don't work. Okay, so I'm definitely not trying to minimize the impact that these alternative therapies can have on someone's life. But when you come see a doctor with a PhD in medicine, we only are talking about what's evidence-based, tested in randomized controlled trials, or prospective cohort studies, meta-analysis, or systematic reviews. So the highest levels of proof. And when an extract, a supplement, or a magical pill does not have any of these 4 types of studies that document their proof, your doctor should not be recommended to you. It doesn't mean that it doesn't work. It just means that there's not enough science to recommend it. Because if we don't put natural products, extracts, and supplements through the same rigorous scientific method and scientific process as we do pharmacological compounds or complex nutrition studies, then you're just living in the wild, wild west where anything can be recommended for everyone for any medical conditions, and no one knows what works and what doesn't. And welcome to social media in 2023. That is exactly what's happening. People get bombarded with contradictory recommendations when it comes to health, from beans have lectins and they're dangerous, to beans are longevity foods, and people are stuck somewhere in the middle not knowing who to believe, when the science is pretty damn clear on what works and what doesn't. People have to understand the different levels of proof and try to live their lives using compounds or making lifestyle changes that are backed up by the highest levels of proof. And if they're not, I try to stay away from them, because we are stepping over dollars to pick up pennies, okay? So moral of the story is listen to the science, and hopefully your scientific literacy will increase as you follow these videos. And slowly but surely, you'll start noticing that certain recommendations, alternative therapies, supplements, extracts, adaptogens, some of them have no science to back them up. And I'm always trying to talk about those that have high-level peer-reviewed science of high quality that back them up. And if they don't, I'll make sure to be transparent about that. Cool. So unfortunately, there are no magical supplements. If there would be, I would be taking them. Nutrition, sleep, stress management, a plant-predominant diet, social connection, and avoiding risky substances is as science-based as you can get when it comes to living a healthy life. Cool? Right on. Happy Friday. Happy weekend. See you in the next video. Peace.